Hi, I'm Dr. Charles Newby, and I live in the Iron River, Michigan area, and I've been a practicing chiropractor for about 30 years. And I like to specialize in some hard and difficult cases, and tonight we're going to talk to you about digestive problems, but I also like to specialize in endocrinology and also neurology. Are you tired of running to doctors, playing Russian roulette with different medications, not getting to the real source or cause of your digestive problems? Are you tired of taking certain medications that only seem to help with the symptoms but don't really resolve the problem? Do you continue to struggle with symptoms like irritable bowel, abdominal pain, indigestion, bloating, loose stools, or constipation day in and day out? Well, we hope to have some new hope for you today. Finally, we're going to tell you how to hopefully get rid of your digestive nightmare. What makes us different as a chiropractor and clinical nutritionist compared to some of the doctors you might have seen? Well, what we're going to do here is look at you not only nutritionally, which we also call metabolically, but in a neurological sense. If you're watching this DVD and you're interested in understanding more about how we can help and diagnose your digestive problem, we're going to be sure to look at every aspect of how your digestive functions and try to get to the root cause of that problem. And some of the things you might hear tonight is probably something that you probably have not heard before. The big thing with looking at your digestive system is looking, first of all, if we were going to look at, for instance, if we were going to take a look at the stomach. And the stomach, of course, is our first part of our body where we have our breakdown in certain foods, especially protein. And a lot of times what happens when there's problems in the stomach itself, we're not making enough hydrochloric acid or not making enough enzymes. Now frequently what happens, we get a symptom of heartburn thinking that we have too much acid. And then you talk to your doctor and he might recommend that you take an anti-acid type medication. But in most cases what happens here is that your stomach is not producing enough hydrochloric acid, therefore you're not breaking down the food, and your body is having this type of symptom that represents heartburn, but really is a lack of breakdown of the food. The problem when protein is not being digested, that protein may kind of rot, if you will, putrefy, cause lots of gas. It may eat a hole through your stomach lining. It may cause you allergies. And what we need to do is assess your stomach, make sure that it has enough enzymes to break down all that different type of food that you're eating. The next step where your digestion system needs to be working really well is the small intestine. That's where other parts of foods are being broken down. A lot of times your fats are broken down there, sometimes your different sugars, and you need to have good enzyme function there. What happens, what causes a lot of small intestinal problems is that the gallbladder itself isn't bringing enough bile into the small intestine. And this happens a lot from the bile getting too thick in the gallbladder. So as the food moves from your stomach into the small intestine, that bile is not flowing properly and you're not getting those enzymes to break down that fat, in your small intestine. So a lot of times we can find out if you have a liver or gallbladder problem, and we can do this through various blood tests. And we can also, through blood tests, determine if you have proper breakdown in your stomach, or your small intestine also. Also, when there's not proper digestion of certain foods, they become more sensitive or allergenic to us. And we can pick that up also on a blood test by looking at the number of monocytes on your blood. And what happens when you don't get that proper breakdown, that food too will actually putrefy, it will rot, it will cause allergies, it will cause reactions in your body, and it'll make you quite sick and give you all kinds of symptoms that you won't be too happy with. Other things we may check for digestive problems is to make sure that your intestinal permeability is good. oftentimes the lining of your small intestine or colon gets broken down so bad that some of the actual waste material from your colon may leak back into your circulatory system. They call this leaky gut. There's a test that we can do to determine if you have that. These kind of problems can cause you to have problems systemically. So you may think you just have a digestive problem, but it could cause all kinds of other symptoms, from respiratory problems to headaches, to allergies and various types of digestive distress that you may have. There are also different tests that you can do for the colon itself through very sophisticated, advanced stool analysis that actually look at the DNA if you should suspect a parasite in the body. Sometimes parasites are missed quite often. Actually, if you went to your vet, he'd probably do a little more thorough examination on your stool and find that parasite, as opposed to some of the labs that some of our human stools get sent to. So we use some very specialized labs that do a really good job as far as rule out parasites. So we want to look at all the function of the different digestive organs. We want to make sure your body is breaking down the food properly. Of course, we want to look at what you might be sensitive to. People are frequently sensitive to the gluten, and they might be sensitive to milk and possibly soy, corn, yeast, and any of these things could cause a definite adverse reaction in your body. So we have to look at all these things, and by checking all this, we try to get to the root of your problem, try to find out what's exactly causing your digestive problem so we can help that. A lot of things we do to help that. Sometimes we might recommend different enzymes that you might need. If you do have a problem with a lining in your stomach or a lining in your intestinal tract that might be broken down, we can rebuild that through natural products. There's natural type supplements and herbs that we can help you get rid of certain infestations or certain growths that are occurring in your colon, such as a yeast problem, a mold, a fungus, or even maybe a different type of parasite. So how has this digestive problem affected your life, your relationships, your activities, how you function? How has it cost you in time and money and happiness? Has it been taking control of your life? Where do you picture yourself in years to come if you really don't get this thing corrected and find the actual cause of this problem? Our main goal here is to avoid any invasive, unnecessary type treatment or surgeries and things like that. So the sooner we can get down to your digestive problem and help that, the sooner we can get you better. If you are sharing this with a friend or family member, also let them know that they can contact our website or our email, and our email is newbydc@yahoo.com, and our website is www.newbydc.com. And you also can call us at 906-265-5175. We'll be glad to help you in any way we can. We're offering a no charge free consultation to sit down with us, discuss your digestive problem, and we look forward to see if we can help you in any way. So thank you for taking the time to watch this DVD, and we look forward to seeing you.